Hello, I'm Dr. Evan.
And I'm Dr. Zach.
And we're with Advantage Chiropractic, and this video was made for you as a care package from a family member or from a loved one. Really, during this video, we're going to cover three main things. Where that lower back pain comes from, what you can do at home to help with that lower back pain, and then last but certainly not least, action steps you can take to start correcting that back pain, because it comes from three main areas within our body. There is a structural component to lower back pain, there's a muscular component, and then last but certainly not least, there's a neurological component.
Yeah, exactly. And like Dr. Evan was just stating a second ago, those three things that can really cause some of that low back pain. So the first thing I want to dive into is the structural piece to it. So if we take a look at the spine here, we can see when we're looking at the low back that we have a nice curve in the low back right here. So a couple things can happen. Number one, that curve can get way too big, and your back's going to start to arch really far in, which is going to lead to some of that low back pain.
Absolutely.
The second one is when we're sitting and driving, we're sitting watching Netflix, we're sitting down looking at our phones, the arch actually starts to go the other way and we flatten that low back out. So those two problems can really cause some of the low back pain. The second portion of that is the muscular aspect. So again, when we don't have that nice curve and our back is too far in or too far out, it's going to really start to stress and tense those low back muscles, as everyone has felt when you're trying to turn and you can feel that low back. That's leading to some of that low back pain. And the third thing is the neurology, or the neurological component to it. So the nerves coming right throughout here, when those nerves aren't functioning properly, when that curve's not functioning properly, when that muscles are pulling everything out of alignment, it's going to lead to a lot of that low back pain, okay?
Absolutely. And the big thing, especially with the lower back pain, especially if you're starting to see some associated symptoms. So what we mean by that is some digestive stuff with the lower back pain, or maybe even tingling down in the legs. That's really telling us that there's a neurological component, and that you could also have a thing called scoliosis. You guys have heard of that before. It's really the shifting in the spine left or right. That's when we really need to look in and make sure that it's not going to get any worse later down in life.
Yeah, exactly. All right, guys, so what we're going to do, we're going to talk through some exercises here to really help with that low back pain that you've been experiencing. So what I'm going to have Dr. Evan do here is demonstrate as I walk him through this, okay? So the first thing is we're going to do the cat camel pose. I want him to get down on all fours just like this. The big thing is when we're doing this cat camel exercise, we're really going to be focusing on his belly button and not up here in the shoulders. That's a common mistake a lot of people make when doing this exercise. So I want him to pretend that he has a string from his belly button going all the way up to the ceiling. What he's going to do is he's going to round his back. You can see right down here is the main point of that. So that's really good. It's also right up here, his head is going down to the ground and he's not arching his shoulders up. Next, what I'm going to have him do is come down and arch really low. That belly button, again, is shooting right through the ground. His head is coming up, so we're getting full spine movement in this as well. So that's a big thing a lot of people are missing, as well as rounding their shoulders and not allowing their head to follow where their body is going. What I want him to do is 10 each way for a total of 20, okay? Very good, and that belly button's going to come down. Awesome. Okay, so the next exercise we're going to talk about here is the cobra position. So what I'm going to have him do is stay down on all fours, and what he's really going to do is he's going to elongate his body forward. He's going to arch that low back. So again, a lot of times we're having a lot of muscular tension in that low back. This is really going to help alleviate that and relieve you from some of that low back pain. So what I want him to do is sit here and hold it for at least 30 seconds. The big thing is when we are doing these stretches, we need them for at least 2 minutes minimum. So it's okay if he does it for 30 seconds, he's just gonna have to do this 4 times. If he wants to do it for a minute, he's gonna have to do it 2 times. But again, the key number here is 2 minutes. The next one, in conjunction with the cobra, I want him to do child's pose. So he's gonna be going back the opposite way. He's gonna put his butt down towards his heels. And the big thing here, he's keeping his hands up front. So he's really helped stretching out that whole back right here. Again, 30 seconds at a time is great. That 2 minute number is what we're looking for here. How does that feel, Doc?
It's feeling pretty great.
Feels really good, exactly. So these are, you can come back up here. So these are some simple stretches I want you guys doing at home today to really help alleviate some of that low back pain that you've been having.
So what I want to focus on now, and this is for people especially at work, one of the worst positions you can possibly be in when it comes to increased stress in the lower back. So something that I want you to take from this, as we increase stress, guess what? We increase pain sensitivity. What does it mean? As we increase stress, we increase pain. It's pretty simple. The position that you are seated in that is absolutely the worst when it comes to the amount of stress that you put on the lower back is this guy right here. So what you can see is seated, leaning forward. So maybe you're at a desk, maybe you're playing video games, maybe you're sitting watching TV. This actually puts the most amount of stress right here in the lower back, which can lead to the lower back pain, sciatica, multiple different things. One of the most important things that you need to do, head up and over those hips. You guys know this, you've seen it before, but we need to reiterate this so that you ultimately don't cause more problems while sitting. The next thing that we want to focus on is pillow position at night, especially with lower back pain. So when it comes to lower back, as you're laying, this is only if you're a side sleeper. So if you are a side sleeper, one of the best things you can possibly do is ultimately put a pillow right in between the knees. Let the knees relax. What this does is it actually opens up the hips correctly, so it doesn't allow any sort of curvature or any sort of stress into that lower back.
All right, guys, those are just some simple stretches and exercises and things you can be doing at home to really combat the problems that you've been having. So the big thing is we got to see if it's neurological, if it's muscular, or if it's a bone issue, or a combination of those three.
Absolutely. So seeing as you have this video, it was sent to you by a loved one, by a friend, we want to let you know that you have an opportunity for a completely complimentary consult and exam with us. And the goal with that is to really figure out if it is neurological, if it is structural, or if it is muscular, or those combinations that we were talking about, to really give you those answers on what you can do to really correct what's going on, so you can live the life that you want to live. So if you have any questions, if you're interested in setting one of those up, call us at the office, 262-505-5610. You'll speak with Melissa or Sierra. Make sure you mention that you have one of these videos, and we'll ultimately get things moving in the right direction. Thank you so much, and as always, live the advantage.